Hi, I'm Kat Hall and I've spent 26 years in the care industry, and today I'm going to tell you how we can fix social care. First suggestion, prevention. Everything in the media, everything in the papers is let's talk about prevention. What can we do as a society to prevent things happening before they cost the government, before they cost the public purse more money? Easy answer is prevention actually is cheaper than the government using the purse to act as a reactive crisis budget. That is the problem we have here. And every single meeting I'm going to, nobody knows the value of prevention. So that is what is preventing us from moving forward. Governments, councils, how can I analyse what we are saving so I can explain to the public where prevention is viable? Well, first thing you need to do is at least try it. I am sick to death of going to meetings and people saying there is no other way to do it. We've tried it this way before. It doesn't work. It does. But funding the prevention first is key. We need to look at things in a wider scale. Tech is amazing. How do we fund that tech to prevent? Look at public services now. Look how many people are suffering with alcoholism, drug misuse. Look at people that are in poverty. All this comes back to the mismanagement of government finance. And then when we start looking at people in poverty, those people then need to lean on social care. And then this is what is driving up the budget. Not just people are getting older, people are living longer, people have lifestyles that are not healthy. What are we doing to support them, to prevent them needing to come into the service? We have people that don't have lifestyle issues, but also don't have the right support in life, so they might make wrong choices. But what can we do to identify those people sooner so they don't need to lean on services? We've had lots of amazing talks about neighbourhood teams, and straight away I hear a neighbourhood team is an NHS doctor, an NHS OT, an NHS care assistant, it's an NHS hub in the community. And I just want to scream and say, why is it NHS? You have all these amazing social care providers that are in the community all day long. We do 2,000 care calls a day. That's 2,000 knocks on a door in communities, runs all structured so they're tight on walking rounds in communities. But we also have gaps in those rotas every day, people that go into hospital, people that pass away. You have a workforce ready and available to integrate into neighbourhood health. Give the providers postcodes and neighbourhoods to manage. Let us pop in and check on people in the breaks. These are the sort of simple ideas that if we come together, have a conversation, we don't need a whole new budget to do things better. What we need to do is step out of the NHS social care, who's getting the budget, who's paying for it. Actually, we can do it now with the resources that we've got. The social care team are the most skilled team. I'm thrilled to say this episode was sponsored by the amazing Ashtrot. Now, everyone knows I love people that support the care sector, and this is exactly what Ashtrot do. If you're like me and you're not very good at IT, they take away all that stress. They manage all your cybersecurity, making sure your data is safe, and we all know, especially in the care sector, this is hugely important. They take all that burden away from us as providers and carers, and they support your staff as well to make sure they are doing things right. This episode has been brought to you because of them, and I'm truly grateful. So if you need help and support, you want it done to a CQC outstanding level, you want the ICO to be happy, then please get in touch with Ashtrot. It is ashtrot.co.uk and you will not regret it. You can imagine they're pretty much pharmacies, cooks, cleaners, nurses, doctors, therapists, mental health doctors. They are multi-skilled, and I think if we get the level of respect that we deserve and we really work as a collaboration, the neighbourhood teams could work, preventative models could work, fund tech, it will work, but somebody has to take the leap. We have to release the funds, and we have to also change the way that councils are managing tech and innovation in their areas. Councils have a legal obligation to act as test beds for innovation in social care and health. But when it comes to the councils making decisions, health will always come first, and that is not helpful. And then when we look at innovations for test beds in councils, they will want evidence that somebody else has tried them first, that they've already got people that are using the system and it's been evaluated. That isn't a test bed. That is, we will use outdated tech that people know about, that's probably clunky, not fit for purpose, but because it's been around, we can trust it. No, we need to risk take. The amount of innovation that's in the marketplace now that can't get a foot through the door because of all of this politics and red tape, that has to stop. The only way we're going to innovate and achieve a preventative model is if we let the providers in. Most of the innovators in health and social care sector are the providers or people that work within those teams, and we need to let those in to be able to go to the new model of care. This model of care, this sector does not work how it is, and we need a sector that's going to be fit for the future, and the only way we're going to achieve that is by listening to the professionals, those that are on the front line every single day, those that have the experience, the knowledge, and are live in the environment, live in your local communities. Nobody knows it better than them. I know I went on a bit of a rant there, but you wouldn't have had me any other way. So what you can do to support now is share this video, like it, tag me in any of your posts, and join Providers Unite. We are on a mission to fix social care and to make sure that we have a system that is fit for the future.